Hi, I'm Becki, and I had cancer. I did a campaign also about cancer and fertility, so this is very close to my heart. But I'd like to introduce you to Dr. Channa. Can you tell us a bit about yourself?
Yes, so I'm a reproductive endocrinologist, so I specialise in treating people with fertility and reproductive problems, men and women, at Imperial College London. And I'm really grateful for the opportunity to speak to you today.
Thank you. And so the first question is every woman diagnosed with cancer at risk of infertility?
So the short answer is that, you know, the treatment that you have to give women, you know, the priority is obviously survival from disease. And women will be exposed to a number of things that may make them at risk of infertility. Including radiotherapy, particularly if the cancer is affecting their pelvis, surgery if it's again affecting the pelvis, and many chemotherapy agents are designed to kill and attack growing cells, and the ovaries are targeted. So the answer is yes, in that there is a risk of infertility with many and indeed most types of cancer.
So the second one is, are there any age limits to accessing fertility preservation after a cancer diagnosis?
So that's a very interesting question, and I think to some extent my answer, you know, is time dependent, because we know that in the UK there are funding restrictions on all types of fertility treatments, and broadly speaking, I think if you have a cancer diagnosis, you should always be able to access the appropriate healthcare. There are rules in certain areas, so CCG care commissioning groups. That means that above the age of 40, then your chances of receiving NHS funding are much lower. But certainly below the age of 40, then it should be a much more straightforward process.
If they're having any problems, who could they get to refer them if the oncologist is maybe a barrier to it?
That's a very good point, and I think, you know, the point you make is excellent, because egg freezing fertility treatment for women has lagged behind men because of the technology of egg freezing. So some clinicians may not be fully in the picture and offer those services. So I think if you're in doubt and you have concerns, I would advise you to seek a second opinion. And I think that's a very reasonable thing to ask, to want to speak to another doctor about it.
So number 3, if your fertility is at risk, what are the options available? So things like family planning, will it be discussed, you know, things like that?
Yes. So if your fertility is at risk, you know, because you are undergoing cancer treatment, I mean, I think the best treatment, if possible, would be to be referred to a fertility specialist to think about whether egg freezing is possible. Sometimes that is not possible because of the speed at which you need to have cancer treatment. But I think it's always worth I think it's very important, I feel very passionately that all patients we want to move to a place where all patients have the opportunity to discuss the options and make a shared decision with their doctor about what's best for their cancer and also for their future fertility health.
Definitely agree. Number 4, which has the most success?
So egg freezing is by far the most kind of commonly performed sort of procedure nowadays to preserve fertility, and this wasn't really possible, say 15 years ago. It was deemed experimental until very recently, and so you would undergo as a patient a type of IVF treatment where you have several hormone injections to grow up lots of eggs. Those eggs are collected from you, and then they'd be frozen at very low temperatures in liquid nitrogen. Some couples could undergo embryo freezing, which is virtually the same, but those eggs are fertilised into embryos, and then the embryos are frozen. It's very similar.
And maybe, say for example, if you're single and you're worried about that, is it the same if you had to come in with your partner?
Sorry, could you rephrase that?
So if you're coming in as a single cancer patient, should you be getting exactly the same as if you came in with a couple? And
Absolutely. I don't think that your needs to preserve fertility in the future are exactly the same. Clearly, it means that embryo freezing, because there wouldn't be the availability of a sperm sample, is not an option. But egg freezing is a really exciting
so at least they
development.
can have the safe kind of mind that they've got at least their eggs frozen. So,
Yes, absolutely.
What is tested when your fertility is analysed, and how accurate is it?
Again, that's a really good question. So, a number of hormones can be measured in blood, and these include your estrogen levels. So that's the major sex hormone made by your ovaries. The follicle stimulating hormone (FSH) is a pituitary gland hormone from the brain, which stimulates eggs to grow. And we now have a test called AMH, so anti-Müllerian hormone, which is now fairly widely available in many hospitals, but not all in the NHS. But that gives us an idea about how responsive you would be to IVF treatment. So it gives us an idea about if we were to try egg freezing, how well that might work. Okay.
And what does egg collection involve, and does it hurt, and how long does it take?
So egg collection, as I said, is after you've say gone through a week or so of injections where you're given artificial injections of follicle stimulating hormone, the pituitary hormone, to grow up lots of eggs. You come in, you have a light sedative, so it's not you're not completely put to sleep, and a needle is placed through the vagina and into actually just collect and squeeze out or suck out some of the eggs that have grown following treatment, and those are taken into the lab and stored. So it really should take about 15 to 20 minutes. It's very safe, and you're given painkillers. It's a minor procedure.
Due to the hormone impact of egg collection, is it unsafe for some cancer patients to have it?
Yes, that's so. Unlike in men, where you can simply give a sperm sample, in women there is this sort of 2-week process of undergoing almost, what is the same as fertility treatment, IVF treatment. So and that generates a huge amount of estrogen growing these eggs. So there may be some situations where the time lost through and the estrogen generated can feed some cancers. So there has to be an individual tailored decision for the patient made together with the cancer specialist and the fertility specialist to try to decide what is the best way forward. So are there going to be some situations where there isn't the time or the opportunity to freeze eggs? I think yes. But should it be discussed? Yes, always.
Definitely. What are the costs of egg freezing, so for embryo freezing?
So I hope that obviously, that this is something that as many people as possible will be able to access in the NHS. In terms of what the costs are, the procedure of egg freezing, in terms of having the injections, the egg collection, say in the private sector, would cost about £3,000.
Okay.
And the annual costs of storing eggs or embryos would be about £300 or so a year.
And say, for example, a patient who's worried that they're not going to get it on time on the NHS, can they just ask their oncologist or someone to refer them to get their eggs saved?
They can. So as I said, I think it's really important to have a choice of opinions. And I think if you feel as a patient that you want to speak to someone else, I think it's best to be upfront with your oncologist and actually speak to them and ask them if anything can be done. And ideally, what would happen is that your oncologist would be able to refer you to someone in the NHS working at their hospital or another one. But I guess the feeling is that maybe if that fails, some people are being pushed to the private sector. And as an NHS consultant, I'd very much want as many people as possible to access it.
That's the main thing.
Absolutely.
How long can you freeze your eggs and embryos for?
Well, once they're frozen, I mean they're frozen at nearly sort of minus 190 degrees Celsius. So there's no practical limit on how long they can be frozen. They're not going to decay. There are obvious practical considerations in terms of obviously your own age as the patient and also resources, so cost.
So if cost came into it, and they're worried about that. If things like IVF, they're thinking about doing that as well, kind of changing things. What could they do if they haven't got the money themselves? Does that mean they don't have their eggs anymore? If years down the line, if they were thinking about that, worst case scenario.
Yes, and this is a really important question that we face. Many patients face. So, in answer to your question, I think all funding authorities in the country have exceptional cases.
Yeah.
So I think it's certainly worth speaking to your GP and cancer specialist to see whether there is any support you can have for a special case.
Yeah.
Because obviously you've undergone infertility for very specific reasons.
Yeah.
And you may well have a case to see whether you could have an extension to your funding.
Yeah.
You can top up funding yourself.
Mm-hmm.
But clearly, this is an issue of uncertainty.
Yeah.
This is.
What is ovarian cryopreservation, and is it available everywhere, and who is eligible and why?
Yeah, so there's a lot of jargon and terminology which isn't very helpful. So ovarian cryopreservation basically ovarian tissue cryopreservation, is that what you mean, as opposed to egg freezing?
Yeah.
So this means this is a very exciting new development in its early stage, and it means that if for any reason freezing eggs wasn't possible, in other words, making them undergo injections and an IVF cycle, for example, if you were a girl who hadn't started having periods yet, we've now had around the world about 100 cases where girls have actually had a biopsy, so in other words a bit of their ovaries removed during cancer treatment, then being frozen and then being transplanted back to that girl, and baby's born, which is amazing.
It's brilliant.
And that number is rising all the time.
Would, say for example, someone having a hysterectomy, they're worried about their fertility. If they didn't want to save their eggs, could they get the ovarian tissues saved? If that took less time than the eggs?
So it's theoretically possible. At the moment, this isn't supported by the NHS. I know that there are charity-funded schemes running. For example, there's a very good one in Oxford, and they're doing some fantastic work, and we're making moves to actually collaborate with them, so that we can offer a cohesive service.
Mm-hmm.
So the truth is, it would be wonderful to try to extend the options available, and there would be key situations where maybe this would offer something for women who would otherwise not have access to the whole process of egg freezing.
So the next one is egg preservation and IVF involves 6 weeks, so putting off treatment. Can this be a possibility for some types of diagnosis?
The answer is it's an individual decision, because it depends on a lot of things. Obviously, it depends on the type of treatment you're going to undergo. So the risk of infertility, also how aggressive and how widespread the cancer is, because the more widespread, then the more risk of infertility there is. The other thing I haven't really talked about is also you and your age. So with women, there is a certain stepwise reduction in the success of egg freezing. So that's above the age of 35. It is the chance of egg freezing working in terms of actually having successful IVF treatment at the end to have a baby is certainly lower than if you were below 35. So I think all of these things it involves a very important discussion and a shared decision on an individual basis. I can't really answer that as a black and white, but there are certainly situations.
But it's up to them and their choice, so to a point they can, if they feel it's right for them.
Absolutely. I mean, and I think more broadly, there are no. I don't think there should be rules. There should be shared decisions, and I think as doctors we need to advise the patients and really try to tailor treatment to help them, each individual.
I agree with that. What advice would you give to someone to talk through the fertility with their partner? So if they wanted to. Yes,
and we have. We performed interviews and sort of focus groups with some of our patients, some of our male patients who've frozen sperm for a long time, and the same would apply for women, where they haven't spoken to their partner, and several years have gone. And I guess, the longer you leave it, the harder it must get. And my own philosophy is to be open. And if you really, I think many patients, I'm astounded every day by actually the strength shown by couples together. So that actually by bringing your partner into treatment, to consultations, so that they can actually talk through their own concerns, I think that's the way forward. So I very much say that the time is always, and so that you can, as a couple, go through and deal with what are difficult issues, but for which there is always advice and help,
and support. How early in a relationship should someone talk about their fertility?
There's no fixed answer, but how often, when would you talk about any other illness that you had? And if it was me, I would be very upfront. It'd be very early on, particularly if you wanted to, if you thought that was a serious relationship. So I don't think it should be any different.
And if they were worried and needed kind of help with that support-wise, do you think like they should go to a support group maybe first if they didn't have the courage to ask someone? Absolutely,
the support group, and I think more needs to be done to try to formalise and standardise the support we can give. We're trying very hard to. You've met Monica, who's been on before me. We're trying at our trust to make us much more open doors, so that patients who have these really important questions can actually pick up the phone, get online, and actually email us and come in and actually speak to us about it.
What are the emotional aspects of going through egg collection to be aware of?
So it's a big deal. Unlike sperm freezing, where you simply have to produce a sample, it feels, it must feel like a fertility treatment in itself. Because in essence, it is the same thing. So there's a lot invested in that, and obviously you're not going to see the outcome until a lot later. So it's I could very much understand people being nervous about it, and obviously there's a time delay which is imposed on cancer treatment.
Alongside that, they could, in theory, go and get maybe support from their mental health if they wanted, if that was going to help them. So they could do it with it, but just at different times. If they felt that gave them confidence and things.
Yes, no, that's a really good point.
So psychological support available. Is it out there in terms with people's fertility and being affected by their cancer?
The answer, there's a lot of support. It's about how you access it, and I guess psychological support is fragmented. So there's some excellent clinical psychologists at our hospital who are attached mainly with the oncology team. So really, and we work very closely with them. So, but the setup may be different at different hospitals.
But it's always good, I suppose, to approach them because they would want that.
Absolutely, because there are very real concerns and consequences of infertility or fertility problems associated with cancer. And one of the big things we're trying to do is learn more about it. It's very much understudied.
Let's go to question 17. Can you explain what temporary menopause is, and can some women's fertility return? So, for example, you could have two women both having their periods, but one will definitely be having the permanent menopause, and others with temporary. But if you're in that unknown area, what would you say for people who worry about that?
So it's not uncommon after treatment for cancer for your ovaries to be stunned and to not be working, and therefore for your periods to stop. And in that zone of uncertainty, there is a chance of recovery and there is a chance of non-recovery. And the key thing is, after maybe sort of within 2 to 5 years, that is the time at which recovery may happen. So things that you may experience may be a return of periods, but returning of periods isn't enough. What you want to do is actually go to your doctor, your GP or cancer or fertility specialist, and actually get the blood tests we talked about to try to see whether the eggs are being released properly and that fertility is returned.
And in a way that gives kind of, cancer patients, they won't have false hope, so they'll know which kind of patient they are, and that will help them maybe come to terms with it if they're not able to.
Absolutely, and I'm quite conflicted. I guess the term menopause in society actually implies something permanent, whereas it's that temporary period is really when your body is recovering, and it's about finding out whether your ovaries can recover as well.
Yeah. Thank you very much for that.
That's all right.
I've got some questions for you.
Yeah.
So, a girl has finished treatment, and I've got my periods back. Is this really a indication that my fertility has returned as well?
Okay, so that's a great question, and so periods returning is a positive sign because it means that there is likely to be the hormonal sequences that happen and normally are occurring. What needs to then happen is a fertility test, which can be just in the form of a blood test, to confirm if eggs are being released appropriately and you're making estrogen at the right levels. So that's a great point, and they really ought to have access to those tests, which are freely available in primary and secondary care.
Another question is, do you really have to wait 2 years before trying for a baby after chemotherapy?
Yeah, so there is no fixed answer to this. We don't know when it is safe to, following chemotherapy, to start having a baby. The idea is that we want to give adequate time for the drugs to wash out and for any potential damage, to tissues to sort of wear off and recovery to happen. I've seen some. I think again it's an individual answer. So depending on your age, depending on the situation, I think there needs to be a shared decision. So there's no fixed point at which you say, right, that's it. You're okay. But 2 years is a common recommendation.
And my other question is, do you think in an ideal world,
yes,
Channa, that a fertility expert is there at the very beginning when a cancer diagnosis is made for young adults?
The answer is clearly yes, and I think you don't need people like me. I think you need people, who are. We have a wonderful, spread of, cancer, CNSs. So clinical nurse specialists like Monica. I think we need to have a network set up of people who actually will collaborate with people like me and be advised by people like me, who can actually be in touch, embedded in cancer centres, so that yes, you have a new diagnosis of cancer and now you need to see your fertility specialist. So I absolutely dream of that model, and I think it's what we need to head for.
Last question: what is available on the NHS for women who have had a partial hysterectomy with ovaries remaining? Surrogacy, is this something you have to do privately and it's very expensive? How feasible is this option?
So I will tell you the truth that the local regulations and funding policies vary. So I don't think there is I imagine that there would need to be self-funding for surrogacy and that type of treatment. But I'm unaware of whether NHS treatment would be supported.
I suppose worst case scenario, people are starting to do GoFundMe pages, so there's always an option. It might not work.
That's true.
Yeah.
That's a really good point. Yeah.
And can you read out the last question, Becki, the green one?
So if someone's just completed active treatment and they were lucky to have embryos frozen prior to their treatment, they've been told that they have to wait 2 years before they can try for a baby. So the question is, in the meantime, is there any way they can check to see if the treatment that they have undergone has made them infertile? If their oncologist has said that they could do a simple blood test, will it show that they're likely to be postmenopausal due to chemotherapy or the hormone?
Okay, so they're within 2 years of cancer treatment and they have frozen embryos. Yeah, so I think in that situation, so that's a great situation to be in, because they have the option of using the frozen embryos, which could be used before 2 years, actually, to be honest. Yeah. And again, depending on their situation, their ages, I think after it, if it's all about what is the risk of her needing recurrent cancer
Yeah.
therapy during pregnancy. So if you think that the risk is very low, then again, there's no fixed rules. I think you could have a blood test within 2 years to see whether you've had recovery, and if you have, then it's really a shared decision about what are the risks of going ahead before 2 years versus what are the benefits.
The last question is, if I've got CML and my best chance of having my own baby one day would be to freeze my eggs in between the first and second cycle. Would you recommend to freeze my eggs, as I don't, regardless of the short timing since my last chemotherapy? Is there a risk to my children of the future if I freeze eggs that there hasn't been the recommended gap between having chemotherapy?
So I wish I could give an answer based on authority. I mean, because of how relatively modern, egg freezing is, we don't really have the data out there to sort of study the long-term success rates in people who've had chemotherapy so soon after, and also look at any effects in offspring. I think this idea that sort of offspring will have, congenital abnormalities is not right. I think the worst case scenario is that the eggs would not work. That no babies would result. And I think there is a significant risk of that, as there is with all egg freezing. And is it worth it? It's always worth it if it's worth it to you. That's my answer.
And so I'd just like to thank you for doing Trekstock Talks today. Really appreciate it.
My pleasure. Thank you so much.